Here's everything you need to know about frozen shoulder. Let's dive right in. Hi, my name is Dr. Ken from Trio Health Chiropractic, your sports chiropractor and athletic trainer. Before we get started, here's a quick timestamp so that you can go into the sections that you're most interested in. I hope you find it very helpful. So what exactly is frozen shoulder? It can be categorized in two ways, primary and secondary. So primary is idiopathic, which means there's no known cause. Secondary is something you may be able to relate more with because there's a history of injury, of disease, or pathology. So who does frozen shoulder affect? Here are some key risk factors that you might want to know. If you are within the age of 40 to 65 years old, if you're gender female, if you have history or are currently experiencing autoimmune disease, diabetes, histories of strokes or heart attacks, thyroid diseases, if you even had trauma to your shoulder or immobilization, so lack of movement in the shoulder already, then you can also be within the risk factor of experiencing frozen shoulder. So let me show you what a classic presentation of frozen shoulder looks like on examination. In this presentation, the right shoulder is going to be the affected side. With shoulder flexion, you would notice that your right arm is not going to go above the right shoulder joint. And that's going to be the same thing with abduction. This motion as well, this right arm is not going to want to go above the right shoulder joint. It's going to feel stuck. Now this motion, external rotation, is going to be the telltale sign of frozen shoulder. This right side is extremely limited when compared to the healthy left shoulder. You're going to experience a lot of pain in that deltoid and that posterior deltoid region. When we go into extension, you will have some motion with this extension, but notice a lot of pain, especially in that front and back side of your shoulder joint. With internal rotation, you'll notice that the healthy left side will go all the way up to the middle back. However, that right unhealthy frozen shoulder side is stuck. It's going to get stuck at that glute. So let's look at the shoulder model. This is a shoulder model of your right side of your shoulder. Now, this is a naked model, so you can't see the muscles. However, you can see a lot of the ligaments and the bony structures. Now, the 4 rotator cuffs are usually going to be on the underside, the top over here, and 2 on the bottom of that shoulder blade area. Now, these muscles are going to be very, very tight, and especially early in the first phase of your frozen shoulder, it's going to be spasming or even painful to touch or to move. Now, when we look at this shoulder model, you're going to notice a lot of ligaments that are holding this shoulder joint together. Now, if you take a backside look, front side look, and a top view, you can tell that this whole shoulder joint, this glenohumeral joint, is almost covered with ligaments because it's a ball and socket joint. But a ball and socket joint is what I want you to think of is golf ball and a golf tee. That golf ball is a lot bigger than that golf tee where it sits on. Now that is very similar to the shoulder joint. The ball of this head of your humerus or this shoulder is a lot bigger than how it sits on this scapula or this shoulder blade. And therefore, because it's such a mobile joint, we need strong ligaments and a capsule to hold this joint together and then covered by a lot of strong rotator cuff muscles to help stabilize and the bigger muscles like the upper trap, the deltoids, the biceps, the triceps to really keep this shoulder stable. The shoulder is supposed to be one of the most mobile joints of your body. However, if you are experiencing frozen shoulder, you're going to notice that a lot of these areas are very difficult to move. Even the slightest movements can cause spasms or shocking pain or shooting pain or throbbing pain because everything is tightening up. There's fibrosis, there's adhesions that are locking this joint up, preventing you from moving your shoulder. That's what's happening when you're suffering with frozen shoulder. Here are other diagnoses of the shoulder that can mimic frozen shoulder. You experience things like arthritis, rotator cuff tears, labral tears, shoulder impingement syndrome, neck pain like cervicalgia or radiculopathies, fractures of the scapula, the humerus, or even the clavicle, bursitis of the shoulder. These are other diagnoses that can mimic frozen shoulder, and that's why it's good to see a healthcare professional near you so you can get the right diagnosis to help you get on the right treatment plan so you can get out of the pain faster. Here are the 3 main phases of frozen shoulder. It goes from the freezing phase to the frozen phase to the thawing phase. Now this entire 3 phase can take anywhere from 1 year to even 3 years. The first freezing phase lasts anywhere from 0 to 6 months. The early loss of range of motion, especially with the external rotation, as shown in the classic presentation, that's going to be the #1 key. Then you'll start to lose or notice the loss of abduction, loss of flexion of the shoulder. With the gradual loss of range of motion, you may experience a lot of muscle spasms, pain with movement and without movement. Even the slightest movements can cause spasms or shocking pain or shooting pain or throbbing pain because everything is tightening up. So even when you're sleeping, you might experience a lot of pain in your shoulder, throbbing with a sharp shooting pain. Things like washing your hair, putting on clothes, reaching for the seat belt, reaching behind your pocket for your wallet. These are simple everyday movements that can cause you pain and discomfort because of the freezing phase of your frozen shoulder. Now the frozen phase, which is the part 2 or phase 2, can last anywhere from 6 to 15 months. In this phase, you may notice the pain has decreased, but now the range of motion is, for the most part, really gone. This can be due to the progressive capsular ligamentous fibrosis. There's fibrosis, there's adhesions that are locking this joint up, preventing you from moving your shoulder. Shoulder joint, the glenohumeral joint, the capsules, the ligaments, the muscles, everything is getting locked up, and now it's considered frozen. Then the final phase, the 3rd phase of frozen shoulder, is called the thawing phase. Now this phase is where you find the hope, a light at the end of the tunnel. You're starting to gain the range of motion back, be able to reach a little bit higher, maybe wash your hair, but a little bit more comfortably. There should be little to no pain, range of motion should be coming back, and the movements should be a little bit more easier. Now with time and exercises, this is the end of the frozen shoulder. So now that we understand frozen shoulder a lot better, let's dive into the best exercises for the frozen shoulder. It doesn't matter which phase you're currently in, these are all safe for all phases. However, if you are in the early phases of frozen shoulder, please do not push the limits, go within your capacity. So the first exercise is going to be for shoulder flexion, and for this we're going to use a small pole. Now, a lot of people would most likely use PVC pipes. However, this is from Target. This is just a shower rod curtain, and the reason why I love this one is because we can twist it and change the height of the rod. So here we go. The flexion motion is going to be this motion, and that's the one that we want to regain. What we're going to do is shoot that rod all the way forward, extend our arm straight, and we're going to do a little bow like this. This is the motion that we want to regain. That's shoulder flexion. Now the key here is to hold it for about 30 seconds. Now, how do you know how much is too much? Now, it's what you can tolerate. So you're gonna notice some spasming, some pain. The pain shouldn't be too high, but it can be a little bit uncomfortable. Now that's up to you to decide. Now, when you hold this for 30 seconds, this is a key. Now, most people will just say, hold this for 30 seconds, and that's a great thing. However, I want you to add a little bit of a massage on this lat region, which is right under your armpit. Now, this is one of your subscap muscles, which is a rotator cuff. You're gonna use your big thumb, grab right under and kind of scoop under your armpit, and you're gonna notice that it's very tender. Now, even if it's tender, again, only to what you can tolerate. Hold that for 30 seconds and just kind of give yourself a small massage, just slightly. And you're gonna hold that for 30 seconds. So that easy flexion, cane-assisted active range of motion, you wanna hold for 30 seconds. Now you wanna do this at least a total of 2 minutes, so that's 4 sets. And you want to do this at least 5 times a day, but if not more. So we just did the flexion exercise where the bar was at 12 o'clock to our body. It was in the front. Now we're gonna walk it out at 1 o'clock. And we're gonna do the same thing, hold for 30 seconds, And as we do that, we're gonna eventually get ourselves to 2 o'clock and 3 o'clock. Now this is that abduction motion. What we wanna do is rest our hand on that top of the rod, and we're gonna come down. And when we do that, again, instead of doing the subscap, like how we released that earlier or massaged it earlier by our armpits, now we're gonna do more of the front side of our chest. We're gonna kind of grip and grab as we bow down, and we're gonna massage this. Now we're gonna be holding this again for 30 seconds. Total of 4 sets, 2 minutes, and do this at least 5 times a day, if not more. The more we do these range of motions, the more deeper we get in with what's tolerable, the faster you can gain that motion back. So again, we're gonna hold this here. If you can't do it at 3 o'clock, go back to 2, maybe even 1, and same thing, massage this front chest area all the way to the anterior part or the front part or deltoid. That's where we want to start massaging. 2 o'clock, massaging, holding for 30 seconds at a time at what you can tolerate. And that's how you're gonna be using this cane. Perhaps you're using a golf club, baseball club, anything that you might have, a shower rod, to help regain your range of motion. The next range of motion exercise that we're going to be doing is external rotation. Now this is one of the most important and the hardest range of motion to get back, so it's very crucial. What we're gonna do is get the end of the rod, place our hand right here, just kind of cup the end, keep our elbows tucked in, and we're gonna use our opposite hand to push our right hand out. Now this is the external rotation motion. Now again, all you have to do is hold this for about 30 seconds. We're gonna push, hold, only to what you can tolerate. Now again, do this for 4 sets, a total of 2 minutes, at least 5 times a day, if not more. This is the same external rotation exercise, except you are lying down. So if you feel more comfortable or relaxed while you're lying down, this is the one to do. You're gonna do the same thing, cup the end of the rod, and you're gonna externally rotate that right arm, pushing with this left arm. You're gonna push across and hold for about 30 seconds. Again, don't force any movements, but it should be a little bit uncomfortable to what you can tolerate. That's the position that you're gonna hold for 30 seconds. Total of 2 minutes, at least 5 sets a day, if not more. This extension exercise we're gonna do is you're gonna use the rod, place it right at that palm. You're gonna use your left or the healthy side. For us, it's the left side. And we're gonna push this rod down to extend our shoulder back. Again, we're gonna hold this to that uncomfortable position, but what's tolerable, for 30 seconds. We're gonna hold this 30 seconds, total of 4 sets, total of 2 minutes. Again, at least 5 times a day. If you do more, you're probably gonna get better faster. The next range of motion is gonna be internal rotation. We're gonna use the same rod or cane or golf club, whatever you have, and we're gonna regain the internal rotation. So what we're gonna do is you're gonna use this right arm, grab onto the pole, use the healthy opposite side, the left side, and you're gonna use that to pull up your right arm into internal rotation. Now, whatever you're comfortable with, that's the range of motion that you're gonna hold at for 30 seconds. Now you wanna hold this for 30 seconds and do at least 4 reps. You're gonna do at least 4 sets, a total of 2 minutes. Now you wanna do this at least 5 times throughout the day, if not more. This next exercise is one that's gonna feel really good. It's called the Cosman's pendulum. Now, if you have some sort of weight, this is a 2-pound ball. If you have dumbbells, or even if you don't have any equipment, maybe you have just a Hydro Flask or a Yeti with a handle, that's gonna do. So what we're gonna do is essentially gap the joint and give some sort of distraction with range of motion. So this is what it's gonna look like. We're gonna go here, brace ourselves on a countertop. It could be a sofa, it could be a bed. You wanna grip the weight, but relax the shoulder. And we're just gonna go in circles, just like that, in the range of motion that we can tolerate. This is gonna give us an axial distraction down to help gap the joint or gap the capsule to help loosen things up. And this is gonna feel really great. Now again, if you don't have a weight, you can use a hydro flask, fill it up with water, make it heavy to give this distraction, and you're gonna go in circles clockwise. You can do counterclockwise, and you wanna do this for about 1 minute total, at least 4 times. So that's a total of 4 minutes, pretty long, but it's gonna feel good. Next, let's try and strengthen our shoulders or activate our shoulders. This is the safest and the best way to approach, especially if you have frozen shoulder. We're gonna bring our fist right against the wall, and almost like we're gonna punch into the wall, we're gonna hold this for at least 8 seconds. If you can hold it for 15 seconds, that's even better. So we're gonna go here and push in directly into the wall. Now keep the shoulder straight, keep the elbow into your body, make a fist, and push against the wall, almost like you want to push yourself off, but don't. And just hold that 8 to 15 seconds, contract, 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 and then relax. And you want to do this about 5 times on flexion and all the other directions that we're about to start. Then we were going to go through abduction. Now the key for abduction is to focus on your elbow. We're going to go against this door and push right on the elbow. And again, we're gonna push our force into the wall using our elbow for about 8 to 15 seconds, holding a total of 5 sets. Next, we're gonna do external rotation. It's the same motion, except now the pressure is gonna be on the back side of our palm. And we're gonna go here, step a little bit back, and push. Keep the elbow into our body, shoulder straight, focus on that back side of the palm and push towards the door or the doorway. You're gonna hold that again for 8 to 15 seconds for a total of 5 sets. So again, the difference here for abduction is the force is on the elbow. For external rotation, the force is on the back side of our palm. But both of them, we're directing our force into this doorway for 8 to 15 seconds for a total of 5 sets. And that's gonna cover abduction and external rotation. Next, let's go into extension. What we're gonna do is use the back side of our elbow and push our elbow into that doorway. And again, 8 to 15 seconds for a total of 5 sets. So finally, we're gonna do internal rotation. And this time we're gonna be focusing on the palm side. You can make a fist or open palm, whichever one's comfortable for you. Gonna go against the doorway, go this way, elbow straight into our body. And we're gonna push in towards this way, into the doorway, and hold anywhere from 8 to 15 seconds for a total of 5 sets. Now this hand can be a fist or a palm, whichever one is more comfortable for you. I hope you found this educational video helpful. Please like and subscribe and comment down below which phase you might be in and which exercises are helping you the most. Take care. Aloha.